My practice principally includes taking care of people with all measure of ear problems, either hearing loss, chronic ear disease, then hearing reconstructive surgery, as well as doing skull-based tumors, which is the neurotology component. One of the things I really enjoy about it is helping people to communicate better. Most of what we do is about hearing restoration surgery or taking care of people who are deaf, who aren't able to hear at all. We do cochlear implants, so we're able to help people communicate who were totally unable to do so before. I think this is an interesting time in otolaryngology and in otology in general. The quality of the implants that we have and what they're able to do for patients, some of the new, more or less invasive techniques have enabled us to do the same things with much less disturbance for patients' lives and really enable them to communicate at very high levels. I run our implant program here, so cochlear implants are really one of my main areas of interest. We have one of the busiest programs in the Northwest. We now have almost 600 patients who've been implanted here, and in fact it might be larger than that at this point. I've done probably 350 cochlear implants, and we typically do about 60 to 70 implants a year here, which is a fairly high volume. So we have experience managing both straightforward cases, and with that volume and that number of patients, we see some of the most complicated patients there are. It's tremendously rewarding. I think part of what got me into medicine in the first place was the fact that I wanted to be in a job where I was communicating with people, and that's what I enjoy the most about what I do, is talking to my patients and learning about their lives, and enabling people to be able to do that more easily it's hugely rewarding. So I was born in the Midwest and then lived in California for a number of years, and then moved to Connecticut where I finished up high school, and I did my undergrad work at Yale University, medical school there as well, and then I came to the University of Washington for my residency in otolaryngology. I'm married, and my wife is an avid traveler and has an interest in international health, so we've done some mission work in Africa where she was working for a while. Then we really enjoy the outdoors. We spend a lot of time hiking and skiing. It's unbelievable when a person who I was unable to communicate with completely, we would oftentimes have to type or use written notes to communicate. They're able to have an easy conversation. It's kind of eye-opening, and then oftentimes they'll invite me into their lives and tell me in what ways it's made them better able to communicate with their family, it's helped them in their jobs, and it's just a hugely rewarding experience. It's hard to come up with a different word for it than that.